Hi, I'm Ellen. I'm going to be your nurse today. So what brings you in today?
I am here for my weekly outpatient care.
Okay. So before we get started with kind of seeing what have been so far, I usually do these screenings. It's an every patient kind of routine. They're personal. It's an interpersonal violence screening. Would you mind if I asked you some questions?
Yes.
Okay. And then again, this is confidential, so this isn't going to go to anyone. This is between you and me. It's just kind of policy, and we like to kind of gauge how more we can help our patients. So, all right. Are we good to begin? Or do you have to any immediate needs? Okay. All right. So we have the screening tool. So in general, how would you describe your relationship? Is there a lot of tension, some tension, or no tension?
A lot of tension.
Do you and your partner work out arguments or work out any of that tension? With great difficulty, some difficulty, or no difficulty?
Great difficulty.
And then do these arguments ever result in you feeling down or really bad about yourself? Often, sometimes, or never?
Often.
Often? Okay. And what are those kind of thoughts? How do you usually feel down?
I just do, whenever we get into arguments or something like that, I just feel upset, feel down about myself.
Do arguments ever result in hitting, kicking, or punching? Often, sometimes, or never?
Sometimes.
And then, do you ever feel frightened by what your partner says to you or does? Often, sometimes, or never?
Sometimes.
And then, has your partner ever abused you physically?
Sometimes, I guess.
And then, has your partner ever abused you emotionally?
Sometimes, I guess.
So with this scoring tool that we have, it kind of indicates that you're at a positive result for current physical or emotional abuse. I know that you said that oftentimes or sometimes that the arguments are really hard for you in different ways, like they end in hitting and kicking. Has this happened in the present or has it happened in the past before?
Both, I'd say.
Okay. And then, do you have any resources available to you or a safe place?
No, I've lost touch with most of my friends over the years, and my husband doesn't want me to hang out with them because I'm too mature for them, and they make stupid decisions when they hang out, and my priest says it is the place of a wife.
Okay. How does that usually make you feel?
I don't know, just unsure, I guess.
Thank you for answering those questions. I heard you say that he abuses you emotionally sometimes and physically sometimes. With emotionally, what does he say to you?
He's just not very nice. He yells at me. He got mad at me because I wanted to go to school, and he told me that that's not something that I should do, and then he hit me. So yeah, that's kind of what he does.
And then do you have any other living arrangements at the moment? Any other support system?
No.
Is there anything that I can do to support you at this time?
No.
Okay. I have this information card here. So you can take this or if you know someone who might need it as well. On the back of it has a bunch of local resources. True North's the women's shelter here. There's a crisis line, counseling center, so it's a good resource. Even if you personally don't feel like you can always give it to someone else. And then, do you feel like you're safe to go home today?
I'm not sure. I think maybe okay. I might be safe to go home.
Did you want to make a plan at all?
I don't think I'm ready for that.
Okay.
I've got 2 children at home, and I'm afraid that if I try to leave my husband or if I try to make a plan to do so, that he'll take them away from me and he'll hurt me in the process.
I understand that must be so hard for you. This did remain confidential, as like I say. So, thank you for answering the screening tool, and we'll get started with what you're here for.
Thank you for this card.
Yeah.